Thanks for opting in to get the fertility case study. Hi, I'm Dr. Alex Perry, Chinese medicine doctor and CEO of the Perry Centre, and welcome to The Fertility Factor. We've been helping women and their partners start and grow their families with great success, and I'm really excited to be able to share this case study with you. I've chosen this story because it illustrates one of the very basic but often overlooked reasons why couples aren't falling pregnant, and perhaps it's part of your journey also. In fact, in my experience, even some of the specialist fertility clinics overlook this key fertility factor, so it's not your fault if it's also been an issue for you too. So what is this fertility factor? The fertility factor is timing. Let me introduce you to our couple. I can't tell you their names, but they're super nice, trying really hard to start a family and having no luck at all so far. In fact, they've been trying now for 12 months and their GP has just referred them to a fertility specialist. Now, this couple sought my help around the same time. And one of the very first things we talked about was timing. So what does that mean, timing? Well, actually timing has three parts. Part one, are you ovulating? Part two, if so, when and is it happening consistently? And three, are you having enough sex and at the right time? Now, this all sounds pretty obvious, but this couple, like many other patients I see, really had little idea if and when they were ovulating at all, let alone whether they were having sex at the right time. So they were really unsure if they were even getting this very basic baby-making factor right. But why is timing so critical? Did you know that when you ovulate, you only have 8 to 12 hours to fertilise your egg? Many couples I see are really surprised by this fact, even shocked. So if you're not 100% clear on if and when you're ovulating, you may well be leaving falling pregnant to chance. And to me, this is far too important to leave to chance alone. So when we started working with this couple, we employed 3 really simple, super effective, do-it-at-home tests to determine if and when she was ovulating. And what we discovered was really interesting. You see, she presumed that she was ovulating on day 14 because the app on her phone and Dr. Google had already told her that. Yet one of my 3 tests showed that she actually had a really strong and long LH surge. In fact, for her it was lasting almost a week. So instead of ovulating on day 14, we discovered she was actually ovulating closer to day 17. Now, what did this discovery mean for this couple? Well, it meant potentially that in the 12 months that they were trying to conceive, their timing had always been wrong. In fact, we proved this was true because once we discovered that her fertile window was a little later than she had thought, and after adjusting their timing, this couple fell pregnant quite quickly. Now, it's not always as simple as that, but getting your timing right is critical, because if your timing's wrong, the sperm and the egg may never even have the chance to meet, let alone fall in love and make babies. That's how important timing is. It's a simple process, but it does need a bit of analysing. And it's super important to be clear and confident that you are getting your timing right also. Now, it may be the difference between falling pregnant or not. So now that you've seen the case study, I hope you understand just how important getting the timing right is. And if it's okay, I'd like to show you a way to be confident that you, just like the couple in the case study, are getting it right for yourselves. Specifically, it's called Solving the Fertility Puzzle, and it's our Fertility Factor flagship course. It's exactly the same process that we take all of our patients through in the clinic. So it's tried and it's tested over and over and it works. So why are the 3 fertility factors so important? Well, as you now know, fertility factor 1 on its own, timing, is super critical. Now, taking you through that part of the course alone could dramatically increase your chances of falling pregnant. And my goal is really to get you set up completely in the next 14 days so you can be confident that you are ticking off these key fertility factors one at a time. So deploying the same training and tracking that we use in the clinic will really empower you to be better informed no matter where you are and what level of knowledge you currently have. Like I said, there are 3 fertility factors. They're not hard to learn, but they are powerful when you deploy them. Fertility factor 1. Now, we'll cover timing. We'll talk you through exactly how to use our simple 3-part tracking system and how to make it fit into your busy schedule. In fact, I'll also show you a tailored way that you can have me analyse your charts for you, but more about that later. In Fertility Factor 2, we'll introduce the main reason why most couples coming to see me aren't falling pregnant and what to do about it. And the final step, Fertility Factor 3, will cover one of the most overlooked parts of your fertility puzzle. Can you guess what it is? It's actually your man. Specifically we'll cover exactly what diet that he should be on to improve sperm quality and the things that he should be avoiding in his life and when is the best time to get him tested. Again, this is the same 3 fertility factors my team uses to make sure that our fertility patients in the clinic are super confident that they're doing everything they can to maximise their chances of falling pregnant. And personally, you know what, I wouldn't attempt to start treating any of my fertility patients without first going through this step-by-step process, especially if you are, as most couples are, trying on your own. Now, have you ever heard the expression, keep doing the same stuff, tends to end up with the same results? Well, you know what, that could be making it harder for you to fall pregnant, because for most couples, it's just a matter of let's start trying. But when it's not happening, what do you do differently in order to get a different outcome that you desire? You see, we actually do this stuff in the clinic day in, day out. And why the Fertility Factor is so simple, it's easy, it's an easy to follow plan to help you get the same results that we get for our patients. Now, until now, the 3 fertility factors was something we only did with patients at the Peri Centre. But for the first time, I'm making it available for you. The 3 fertility factor program is only $297. It's a fraction of the cost of visiting us at the Peri Centre. If you'd like to start working with me today to maximise your chances of falling pregnant, it's really easy. Click the Add to Cart button and start planning your pregnancy success today. And you know what? I'll give you instant access so you can make a start right now. And in case you're wondering, like all fertility factor trainings, this one is protected by our 60-day, no questions asked guarantee. In other words, if you aren't happy for any reason, just let us know and we'll give you your money back. We don't think you'll need to use that, but you know what? Just like trying on some clothes at the store, we want to make sure this is the right fit for you. You either get the information you're after or you get your money back. It's as simple as that. So click the button below and start your journey to parenthood today. I'm Dr. Alex Perry, Chinese medicine doctor, founder of the Peri Centre, and I really look forward to meeting you on the other side.